Okay, good morning. Welcome to the OSU Center for Health Sciences. Thank you. I'm Casey Schrum, the president of the OSU Center for Health Sciences, and it's a privilege to welcome you all this morning. I also hold the George Kaiser Family Foundation Chair of Medical Excellence and Service, as well as the St. Francis Health System Endowed Chair in Pediatrics. So on behalf of the OSU family, I'd like to welcome you all and thank you for joining us for the opening celebration of the AR at Marylouise Tandy Academic Medical Building. We are delighted that so many of our friends have joined us. We have our friends, supporters, educational partners, our university colleagues, civic leaders, and elected officials here with us this morning to help us celebrate what is a very historic day for us on our campus. But before we welcome President Hargis and Regent Milner to the podium to speak, I'd like to take a few moments to recognize some of our distinguished guests who are with us today. Oklahoma State for Higher Education Regent Jeffrey Hickman, our OSU A&M Regents, Dr. Regent Trudy Milner and Regent Tucker Link. We have some VIPs from Stillwater, OSU President Burns Hargis, the first cowgirl, Ann Hargis, and one of our distinguished state regents just made his entrance, Regent Jay Helm. Dr. Tom Kuhn is the Vice President and Dean, Division of Agricultural Sciences and Natural Resources, is with us. Dr. Kuhn. Dr. Ken Eastman, Dean of the Spears School of Business, is with us as well. Dr. Chris Ross, the Interim Dean of the Center for Veterinary Health Sciences, is with us. And Gary Shutt, Director of Communications, as well. Our public officials, the Honorable Terry Kern and his wife Jeanette. There they are. State Representative Carol Bush and Kyle Hilbert. Kyle, there we go. All right. And Tulsa City Councilwoman Jeannie Q. There she is. So our tribal, educational, and health partners are also here this morning, and we have representatives, and I'm going to name a list, and if you'll hold your applause till the end, the OSU Medical Authority, St. Francis Health System, St. John's Health System, McAllister Regional Health System, Blue Cross and Blue Shield of Oklahoma, the Cherokee Nation, Choctaw Nation of Oklahoma, Muskogee Creek Nation, the Oklahoma Healthcare Authority, the Oklahoma State Department of Health, the Tobacco Settlement Endowment Trust, the Oklahoma Osteopathic Association, the Osteopathic Founders Foundation, and the University of New Mexico School of Medicine. So we are truly, let's give them all a round of applause. We are truly humbled by the incredible outpouring of support for the OSU Center for Health Sciences from within the OSU system, from our governmental leaders, from our tribal partners, from our educational partners, and everyone who's here with us today. Thank you again for attending and showing us your support for OSU and for the important mission that we have. So it's now my pleasure to turn the podium over to President Burns Hargis.
Great entrance, Jay. That was really well done. You could have just blended in up here, but no, he's a great friend and he never disappoints. Well, welcome everybody. This is a very special day. I want to start out by thanking all the donors that have made this possible and have created literally one of the highest tech and orangest buildings in America, which we appreciate very much. A quarter of a century ago, the Center for Health Sciences came into the OSU family. And since then, we've been producing great docs from all around the country and Oklahoma, and who are serving primarily rural and underserved areas. This facility, this Tandy building, is absolutely the highest tech medical building in our state. The simulation that can go on in there is absolutely remarkable. I did surgery myself right in there, and I'm sorry to say we lost the patient, but all of the things that you can do are so remarkable. We had an ambulance show up with a mannequin, fortunately, but came in, and you go through the entire process, and there's no way you can learn this without doing it, and the ability to learn it on something that you can't kill or hurt is really valuable. So I think that this is going to set the curve for, frankly, medical education in the future. I also want to say thanks to Casey Schrum. I think Dean Schrum has just done a marvelous job. When she was appointed dean, she was, I won't say real young, but she was pretty young for a dean, and infinitely better to look at than Ken Eastman and Tom Kuhn over here. But I just cannot say enough about what Casey Schrum has managed to here, not only in turning out great docs and raising lots of money, but in really spreading the OSU Center for Health Sciences all around our state and recruiting young people into medicine. Casey, you've done a great job, and but I hasten to add that there's no money for bonuses, so that was your bonus. I hope you enjoyed it as much as I did. Well, I'm gonna turn the podium over to those that know what they're talking about. I just want to tell you how proud we are that you're here, how proud we are of this building, and how proud we are that we're serving Oklahoma. Thank you. Go Pokes.
Good morning. I'm Dr. Bill Pettit. I'm the provost for the Oklahoma State University Center for Health Sciences and the senior associate dean for the College of Osteopathic Medicine. I get the opportunity, although she's already introduced casually, I get to make the formal introduction of a very good friend of mine, our A&M Regent, Dr. Trudy Milner. Dr. Milner is a proud graduate of our medical school, class of 1988. There's two of them here. All right. Regent Milner was instrumental, really, in rallying her classmates to name one of the classrooms in our Tandy building. And true to her normal style, actually was able to get more than anybody else in the group. So we're very proud of her. Many of her classmates donated to that gift, and much deep appreciation for what they've done. And so with that said, Dr. Milner, please come to the podium. Thank you.
Thank you all so much for being here. This is a great day, and I'm going to digress for a second and just say that the class of '88 was the very first class to graduate from OSU Medical School. Let me switch over to me, because I don't have it memorized. Thank you, Dr. Pettit, for that sweet introduction. We go way back. On behalf of the OSU A&M Board of Regents, congratulations on the opening, and it's wonderful to be here with you. I am so grateful for the opportunity to be here this morning and share in this celebration. Like many of you have toured the Tandy Medical Academic Building, I am blown away by this building. It is really extraordinary. We have a number of medical school alumni in the audience who can recall when we were in school, all we had was a stethoscope, a stack of dusty books, and we didn't have iPads, tablets, smartphones, much less mannequins like the ones that are now available in the new academic building. I'm so pleased that the current and future OSU medical students will have the opportunity to train in the learning environment that will allow them to make mistakes, not kill patients, and that will allow them to learn from those mistakes. They will become better doctors because of the experience and learning opportunities made possible by this building. As a land-grant institution, our mission at Oklahoma State University is to improve the lives of people in Oklahoma and to promote human and economic development through the expansion and application of knowledge. Our medical school graduates will take the medical knowledge that they have gained at the academic building behind me, and they will be able to deliver high-quality care in a compassionate, patient-centered manner to Oklahomans living in every corner of this state. Communities across Oklahoma will be healthier and better because of the learning that will take place in the Tandy Academic Medical Building. As an alumna of the College of Osteopathic Medicine and as a regent, which I'm so privileged to be, I could not be more proud to stand with you to commemorate this historic day for the OSU Center for Health Sciences and for Oklahoma State University. Congratulations on your achievement. I guess I won't turn my head. And thank you all so much for coming.
Thank you, Trudy, for all that you do, and you're a wonderful friend and representative of OSU Center for Health Sciences. So today is a accumulation of a journey that began over a decade ago. OSU Center for Health Sciences has always had the essential ingredients to train the very best doctors for rural and underserved Oklahoma. We have a clear sense of mission. We have talented faculty and staff who are dedicated to teaching. And we have students who are passionate about our mission for primary care. What we have lacked was the proper building to support the type of interactive, hands-on training that we knew our students needed to become outstanding physicians. So 10 years ago, we didn't have a plan for a new building. We didn't have a promise for a new building. We certainly didn't have the funding for a new building. But we were undeterred nevertheless, and we began to lay the groundwork for a new building just in case we could achieve the impossible one day. Well, today, you can see that the impossible is actually a reality, and we have many, many folks to thank for helping us arrive at the end to this long but worthwhile journey. First, we had leadership support from the very get-go. President Hargis and the Regents fully appreciated what this building would mean for our students as well as the health outcomes of our state. We also benefited from the wisdom and the guidance of a design and construction management team that was second to none. Our colleagues in long-range facility planning and our friends at Dewberry and Flintco guided us through every step in the process, and they were fabulous. Mike Buchert of Long Range Planning Facilities and Dave Huey of Dewberry, Dave Coleman of Flintco, and their respective team members are here with us this evening, or today. Sorry, it's not evening, clearly. But will you all stand so we can acknowledge you? One of the reasons why we want to applaud them is that they finished on time and under budget. So, we also had a team of internal folks who went above and beyond for us to make this building a reality. Dr. Jim Hess and Eric Pollock crunched the numbers to ensure the financial planning of this project. Dr. Robin Dyer spearheaded several meetings with faculty and students to ensure that we were incorporating their ideas into our plan design. Our colleagues at the OSU Foundation, led by Steve Mason, left no stone unturned and gathered so much support to make this building possible. We also have a multitude of students, faculty, and staff who participated in focus groups and served on committees to ensure that our needs today are met in the building, but also in the future. And last, but not by any means least, we owed a debt of gratitude to our alumni, our parents, our community partners, our friends, faculty, and staff who stood by our side and invested in this project with us. Now I'd like to share a brief video that encapsulates our gratitude to our supporters. So please direct your attention to the screen.
Well, besides being beautiful and a centerpiece, I think, of Tulsa, it's certainly going to draw attention.
Well, it's quite a bright orange. No one can miss it.
The first huge addition to the campus, and now this is an even bigger addition to the campus.
We're very excited about having our name on the wall.
Where they can make them have a heart attack, give birth, throw up.
From bleeding to coughing to blinking to talking.
My God, what have you done?
When we made this grant, it was to be above and beyond just taking care of Tulsa, because we saw the need for health care in Oklahoma. We together are helping provide future physicians with the training and education to wherever they may settle to take care of patients with the best knowledge that they can be provided.
And the thing that I really love about OSU is that they're not just focused on the cities, but they're focused on all 77 counties and working so hard every day to make sure that we have doctors throughout rural Oklahoma.
The best equipment, cutting edge technology.
It's obvious that they are getting better cutting edge training than we did.
I was also very humbled that my family had chosen to invest in my education and my school in this way.
When you choose this profession, you give a lot. This medical profession is one of giving.
My wife and I both have instilled in our sons just that you always give back, and that if you've been blessed with a lot, then you have that responsibility.
I look at my grandparents and what they did, so I always try to do the right things and help other people.
My name's on that wall because I think the profession should be continued, and one of the ways we can continue that is support the basic education.
When I've been able to come into the building and bring people with me the first time, it has been equivalent to having someone on a recruiting trip as a Division I athlete. You're going to be a doctor, and not only going to be a doctor, you're going to be a doctor with all these tools at your disposal. And these are the things that we're going to teach you in order to become the next best and greatest physician and hope for your family.
The Tandy building adds so much value to my education. I'll be able to hang out in those simulation centers and learn so much more. The ICU, OB, ER. If I was able to meet any of the donors for the Tandy building, I'd find it pretty hard not to give them a big bear hug, because it's so exciting that we get to learn in such an amazing space, and it makes this a pretty unique campus.
By giving their donation, they're not just, helping to build a building. They're helping to build the future of quality physicians here in Oklahoma. By having the opportunity to work in those simulation labs, by having the opportunity to work in collaborative environment in those new rooms, having the better sound systems and better audiovisual systems in our clinical skills lab, that's going to go a long way. Thank you.
When we were presented the opportunity, we talked at length about where our impact should be. We knew that we wanted it to be in medical simulation, because I think that that's the future of training physicians.
For years to come, as patients go through that room and as doctors go through that room, they'll see our name on the wall, and they'll know that we're committed to OSU Center for Health Sciences, and we're committed to healthcare all across Oklahoma.
I have not had a chance to meet any of the donors yet, and with such a huge philanthropic donation, I would just want to really thank them from the bottom of my heart for making me able to experience medicine in a completely new and innovative way.
Tandy Medical Academic Building is really the future of medicine. It's the innovation spot on our campus.
It's big news. Everybody knows about it that's interested in medicine, and I think it's really good at putting us on the map.
Well, words truly cannot express our gratitude to everyone who contributed to the Tandy Academic Medical Building. We truly are grateful and feel blessed to have you as a part of our OSU family. We had over 150 donors who answered our call to create a better learning environment for our students. And I'm proud to share with you that 85% of these donors were our medical school alumni. We're very blessed to have amazing support of our wonderful alumni. And if you're an alumnus or an alumna of our medical school, will you please stand or raise your hand because we have people standing. Thank you for all that you all do for us. Our patient-centered Clinical Skills Laboratory on the second floor of the building received tremendous support. All 18 exam rooms and patient waiting rooms were named. We had 7 medical school classes that came together to name an exam room. And I want to list all of those for you because each of them are very important. The class of 1978, the class of clap for your class. Class of 1979, class of 1981, class of 1983, class of 1985, class of 1987, and class of 1988. And I want to extend a special thanks to our alumni who served as class leaders, who went above and beyond sending letters, emails, and texts to encourage their classmates to join in. So a few of them are with us this morning. Colonel Philip Noakes and his wife Teresa. Dr. Terry Grew and his wife Jill. I know that they're here. Dr. Dennis Carter and his wife Sherry. Dr. Gary Goodnight and his wife Jean. Dr. Jay Cunningham and his wife Terry. Regent Milner. And Dr. Jim Melton and his wife Liz. Following alumni, parents, faculty, and organizations also named exam rooms, and if you'll hold your applause till the end, Dr. Mallory Spoor Baker and Dr. Damon Baker, Dr. Tammy Kaler and Dr. Dwayne Kaler, Provost Dr. Bill Pettit and his wife Marnie, Dr. Nabil Saruji and his wife Penelope, April Smith and Jim Ryan, the Richard Stabb DO Symposium, Dr. Bobby Daniel and his wife Wally. And Wally and Bobby also named a study carol in honor of their son in the building, so we are doubly thankful for what you've done. Dr. Rick Schaefer and his wife Beverly. And Beverly actually made this gift as a surprise gift to Rick. And so I'm glad the secret's out because every time I was around Rick, I felt a little guilty not saying thank you. So thank you, Rick, and we're glad that we don't have to keep a secret from you anymore. The Blue Cross and Blue Shield finished out our patient-centered clinical skills lab by naming the patient waiting area. Dr. Pete Aaron and Mercedes Milbury Fowler are with us from Blue Cross Blue Shield this morning. Thank you. Our Hospital Simulation Center also garnered tremendous support from the Osteopathic Founders Foundation, and they named the ICU suite, and Sherry Weiss and Dr. Scott Cyrus are here with us, as well as his wife Janelle, and I saw them. There they are. Thank you for joining us. The Morning Crest Healthcare Foundation named the Trauma Suite. Greg Fallon is with us today. I saw Greg somewhere. Jim and Liz Melton named the Surgical Suite, and I have to say Jim and Liz's gift is especially meaningful to us for two reasons. One, theirs is the largest cash gift to be given by an alumnus to the school, as well as a little secret. I think it's a secret, but they are also big OU fans, so we think it's incredible. So I'm going to shout that out because he gave us a gift, and they are OU fans because they believe in what we do, and we so much appreciate that. Give a round of applause to all of them. We were able to outfit the simulation suites with the latest technology and purchase state-of-the-art mannequins because of the support received by this wonderful group of individuals, and we so much appreciate it. The most widely used space in the Tandy building is the first floor lecture hall, which has been named in honor of two of Tulsa's most beloved citizens, Anne and Henry Zarrow. And we do have, although they're not with us, but their generosity and their continuing legacy lives on through the family foundation at the Anne and Henry Zarrow Foundation. And their daughter, Judy Kishner, is with us today, as well as her colleague, Bill Major, and Courtney Knobloch, and so we so much appreciate that. In addition to supporting this building project, the Anne and Henry Zarrow Foundation also support medical scholarships, healthcare delivery programs at OSU Center for Health Sciences. We recently received a transformative grant of $2.3 million from the foundation to support the Project ECHO and the Rural Oklahoma Research Network, and so we are so excited about that. We're also grateful for their partnership in working towards improving health equity in Oklahoma, and especially in mental health, in addition to rural access. We would not be standing here today if it weren't for the visionary support that we received from the AR and Marylouise Tandy Foundation. The Tandy Foundation provided the seed capital that jump-started our building project. Their gift of $8 million represented the largest gift ever received from the private sector by the OSU Center for Health Sciences. Carol Tandy, the daughter of AR and Marylouise Tandy, is with us here today, along with the Tandy Foundation advisors Mark Bartell and Tom Murphy. We are especially, we are especially indebted to Mr. and Mrs. Tandy, the benefactors of the Tandy Foundation, and their legacy in caring for humanity will live on through our graduates, and I know everyone who drives down 75 cannot miss Tandy. If you miss the brightest orange building in the state, I don't know. We have ophthalmologists we need to introduce you to, so. And just when you thought we were done with construction and fundraising, we are only getting started. Our campus in its current state by any means would not make the cover of a landscape magazine. But all that will change come May of 2018. We're delighted to share with you that in a few short weeks, we will be breaking ground on the Cal and Maryland Vote Pond and the Kern-Headington Terrace. You can get a glimpse of those planned renovations and makeovers today. We have renderings on campus. The pond and the terrace will dramatically change the look and feel of our campus. Judge Kern and Jeanette, along with Jeanette's brother Tim Headington, made a leadership gift to provide our students with an amazing outdoor space for studying and gathering. And Cal, thank you. Students spend so much time on campus studying and in the classrooms that We are so, I think it's so important to invest in space for our students so that they can have a break away from the classroom and really have that place to focus on themselves for just a little bit. So we're so appreciative to the Kerns, Headingtons, and the Votes for participating in this project. Cal and Maryland's gift will provide the water feature that will be a landmark for our campus for years to come, provide some tranquility and beauty and calmness to the campus when there's a needed break from studying. We have 3 generations of Votes with us this morning. Cal, his son Stephen, and his grandson Eric. And if you are impressed with the architecture of the Tandy Medical Academic Building, please share your enthusiasm with them. Stephen and Eric were architects at Dewberry and were part of the team that was led by Dave Huey, who designed our building. So we have this special connection with the Votes. So we're glad to have all of you here with us today. So thank you all, and let's please join me in saluting everyone one last time before we invite our keynote speaker to the stage. So I'd now like to invite our keynote speaker, Dr. Sanjeev Arora, who's the director of Project ECHO, which stands for Extension for Community Health Outcomes. He's a distinguished professor of medicine at the University of New Mexico Health Sciences Center. He developed Project ECHO as a model and innovative platform for service delivery, education, and evaluation. This model has been adopted by universities, healthcare systems, governments, and entities across the world. And it has also been adopted right here at Oklahoma State University. With Dr. Rohr's support and guidance, we adopted Project ECHO last November. Dr. Rohr has been a wonderful friend to Oklahoma State University and to me as a person. So it is my pleasure to welcome him to the stage. Please help give him a warm cowboy welcome, Dr. Rohr.
President Hargis, President Shrum, I'm honored to be here. It is truly a great privilege, an honor to be invited by an amazing university like the Oklahoma State University. I am totally blown away by the mission orientation that this state university has to the healthcare of the citizens of Oklahoma, and how every decision you make is so guided by the welfare of the people. This is truly a unique thing. I also want to pay respect to you, the citizens of Tulsa. So as part of ECHO, we are in 23 countries, going to be in 40 countries in the next 12 months. I travel the world, and I haven't seen a city like Tulsa. And I'll tell you why I say that. We recently had a major boxing match, so I'll use a boxing analogy. This is like a city of 800,000, call it lightweight championships, but you play in the super heavyweight in terms of philanthropy and the amount of philanthropy there is, and how the citizens of this city get together for the public good. And so please join me in giving everyone in Tulsa a big hand for that. So in my speech, I want to start in 1862. The Civil War of the United States was in full swing, the American Civil War. Abraham Lincoln was the president. And at that time, there was a representative, Justin Smith Morial. In 1862, he introduced the Morial Act. And what that said was that the federal land that was being sold would be used to build agricultural colleges. In 1890, that became a regular appropriation. And they were going to do mechanical arts and agriculture. That means do the science of how to grow the best wheat and corn. And basically, by 1914, they actually knew how to do an amazing job there, but the issue was the same issue that exists in healthcare today was existing in 1914 in agriculture. There was no way to get this knowledge from the agricultural colleges, the land grant universities, to the farmers. So they created the extension service, the extension agents, the extension offices that you now have. And they were very successful in making the United States the most prolific producer of food in the world. We have the same problem in healthcare today, a very severe problem in that knowledge is trapped in the heads of super specialists and large universities, and there is no way to get it to the last mile of healthcare. In this case, having an extension agent will not do. There's another problem, and that's a problem that the growth of knowledge is so fast that medical knowledge is doubling every 3.5 years, and in 20 years more knowledge will be created than entire human history. So what that means is, how is the primary care clinician in the rural area going to provide good care to the patients they see? Because the patient requires this knowledge and the doctor or the nurse doesn't have it. Why is this center, by the way, this building is amazing. It's beautiful and it stands for more than just the equipment inside it or the beauty, because it stands, in my mind, it represents the force of technology and how technology can be a disruptive force in healthcare. So let's go back to how technology has disrupted other fields. You know, I was born in India, 1956. And when I was a high school student, if you needed a telephone line in India, you had to get in line, and it took 5 years to actually get a landline to your phone. Otherwise, you didn't have a phone in your house. And people said that it would take 50 years, 100 years before Africa and India would get telephones, basically. So the AT&T developed a cell phone. It was this big. And they engaged the very top consulting firm in the world to tell them, you know, how much investment should we make in this thing? How many cell phones will there be in the world in 10 years? And this very top consulting firm charged them millions of dollars and told them there should be about 1 million cell phones in the world in 10 years. And you know what happened? There were 400 million cell phones. And everybody in India, for a population of 1.2 billion, they have 1.4 billion cell phones. Everybody in Africa has a cell phone, and game over. What caused the game to get over? Technology. This is the force of technology. The same was true in knowledge. If you were living in a village in Kenya, you had no way to get a great education, but now every child there can go on the internet and get a lecture from OSU or second-rate universities like Harvard and Stanford or anything else that they wanted to do. So I think that that's where internet disrupted the knowledge distribution system in the world just like that. And it didn't take 50 years. It took 10 years, 15 years, like that. Where's the next disruption coming from? The next disruption is coming in a place close to your heart. So I want all of you to be preparing yourself for it. It's coming in the field of solar technology, where the solar cell will become so inexpensive that solar energy will become 1/4 the cost of electricity, of oil-based or diesel-based energies. And we have to prepare for that, because it will not happen in 50 years. It will happen in 10 years. And this is the challenge that exists for anything we do the existing way. So now let's look at healthcare. That's closest to my heart. Technology has not disrupted the field at all. We have a huge problem in healthcare. If you're born in Malawi right now, you live 47 years. If you're born in the United States or Japan, you live 83. If you are a child born in the world, you have a risk because 21,000 children die every day of diarrhea, pneumonia, malaria. These are diseases that we know how to treat. It costs 1 or 2 cents, but the knowledge doesn't exist in Africa to manage these diseases. Closer to home in the United States, African American women in the late 70s were dying at the same rate for breast cancer as white women. Today, African American women die 42% more likelihood of dying from breast cancer than a white woman. Why is that? Because medical knowledge came along, progress occurred. There's no way to get it to the last mile of healthcare. It's like being stuck in rural Kenya waiting for your landline to show up. It's not going to happen anytime soon. So therefore, technology is the only way to disrupt this. If we don't change the way knowledge is distributed all over the world, we cannot expect peace. These kinds of disparities are not consistent with the values of equity that we all hold dear. What will happen if we don't distribute this knowledge? It will lead to poverty, to war, to death. There can be no peace for any one of us unless we figure out a way to change this disparity, and technology can be a solution. So I'm a gastroenterologist, and I was treating a disease called hepatitis C in New Mexico. This is a disease with 70 million people in the world. If we don't do anything about it, 20 million will die. Only 3% of the world's population has been treated. I was treating hepatitis C in my clinic, and 28,000 patients in New Mexico had been diagnosed, and less than 1,500 had received treatment. They were coming to see me to receive chemotherapy, which I would give them in Albuquerque, but they would have to first wait 8 months for an appointment and drive hundreds of miles, making 12 trips, 250 miles each way. So if you were poor, you didn't have a chance. You couldn't get treatment. So we developed ECHO, a technology-enabled solution to move knowledge instead of moving patients. What does ECHO, how does it work? We said we would use technology to leverage the expertise of a multidisciplinary team of specialists, a liver specialist, psychiatrist, and a pharmacist. We would share our best practices with them. But of course, sharing best practices with a rural doctor with a guideline, there was no way they were going to give chemotherapy to a rural area. After all, there are lawyers in there. So what we did is we set up 21 centers of excellence for treating hepatitis C all over New Mexico, 5 in the prisons and 16 in community health centers, rural community health centers. Each was run by a family doctor or a nurse. And we said, we're going to make you experts the same way I became an expert. I was doing my fellowship in Boston. I would see a patient, present to my professor, see another patient, present to my professor. I kept doing it for 2 years, and then they started calling me a gastroenterologist. I said, aha, I can do this. I can make you a hepatitis C-ologist if you are willing. So these 21 centers of excellence were created, and the way we would train them is case-based learning to master complexity. The heart of ECHO is that every Wednesday afternoon, we have a tele-ECHO clinic where all 21 of these sites join, and one by one they present patients in a de-identified way, no names, to each other and to our team. And we discussed those cases, we helped them. And what we found was that they rapidly started becoming experts. They were becoming better and better every week. After a year, they may have presented 10 or 12 patients to me, but they learned on 300 because they were learning from each other. It was like Hollywood squares on a television where each of them could talk to each other and listen to each other, and everyone a teacher and everyone a learner. It increased their professional satisfaction, reduced their isolation, produced joy of work for them. But most importantly, we did a study to show that they could produce the same level of care with chemotherapy in a rural area, and published this in the New England Journal of Medicine in 2011, showing a rural doctor can do as good as an OSU multidisciplinary team if you support them with echo. So this told me that in order to going back to that problem that no one has a landline and no one has a phone, I said the way to solve the problem of healthcare in the world is to change the mission of a university, all the universities in the world, all at once. How do you do that? Then you partner with somebody like Casey Shrum and President Hargis and say, your role is not just to train medical students and residents and send them out to practice, but to actually mentor and support them for the rest of their life as new knowledge is created, a new game, moving knowledge instead of patients. As we saw echo working for hepatitis C, we replicated it for many disease areas. Wednesday afternoon, hepatitis C. Monday afternoon, rheumatology. Friday afternoon, addiction. Thursday, mental health. And we do 42 projects in New Mexico. And for all the representatives and state legislators in the room, I want to say that our state of New Mexico supports us with a $3 million recurring appropriation for ECHO. The University of New Mexico supported. And I encourage you to consider supporting OSU with a recurring appropriation for ECHO. Not only so we set ourselves a goal that we would help 1 billion people by 2025. And since there were only 2.2 million people in New Mexico, I couldn't reach my goal of 1 billion doing ECHO in New Mexico. So we said we would teach other universities in the world to do ECHO. We would give them all the knowledge, the equipment, the software, the Zoom video conferencing platforms, the software to run echoes, Echo Box, the knowledge platforms to store all the knowledge and curricula and presentations. And we said, we'll give you everything if you're willing to adopt Echo to serve your people. And now 77 universities in the United States do it. Apart from the first grade, so of course OSU is one of them, and they do ECHO for mental health, addiction. They're starting an ECHO, and I see the champion in the back, the yellow dress, and she is going to start an ECHO for HIV and viral diseases in OSU. And I know Casey Shrum wants to start one for pediatric obesity, start with children. And now we have thousands of clinicians in New Mexico and hundreds of thousands of clinicians all over the world being mentored. We're in 23 countries, 139 universities. Most of the major universities in the world are also doing ECHO. But another thing happened is we started rolling out ECHO outside of healthcare and education to train math and science teachers. We have an ECHO for veterinary medicine. I was speaking to the dean of the business school in Stillwater yesterday, and he came up with the idea of starting an ECHO to mentor young entrepreneurs who are starting businesses where the case is not a patient, but their small business that they're trying to grow. President Hargis came up with the idea, and we discussed together the idea of training our farmers using ECHO on organic farming. Because as you know, this is a new and emerging field in the United States. Lastly, I want to tell you one of the reasons ECHO is so successful in OSU is this young lady, Casey Shrum. I had the privilege to run into her and meet her, and literally she got ECHO in about 7 minutes flat. And by the time I was like 1/3 into my presentation, she'd already made up her mind to do ECHO. And it's her perseverance and insistence and the amazing support from the Zarrow Foundation here, which actually allowed, they gave $1.8 million for the setting up of ECHO projects here. which will support them for 2 ECHO projects for 3 years. And I was sort of surprised, this much motivation for public service, amazing. And then I found out, this is not just her motivation to OSU. ECHO is just a way of doing something. The underlying motivation is to help poor people, underserved people, and live a life of service. And she has lived that. I was totally blown away, and I was telling her, Darren, her husband, Darren, last night at dinner, I was saying, what impresses me most about you as a family is that you have 6 children, 3 your own, and then you've adopted 3 children from Ethiopia and have grown them to become amazing citizens, and what an amazing type of service. So my hat's off to you for service in such a public way. I want to take this opportunity to join this movement to democratize knowledge to change the world for the better. We have a movement going on, and we need every one of you to join it, big time, because there is no alternative. There was a quote I quoted yesterday. How many know Albert Schweitzer? So Albert Schweitzer was a physician. He was a Nobel Prize winner, and he said something which resonated with me when I first read it decades ago. And he said, I don't know what your destiny will be, but one thing I know for certain, that the only ones amongst you who will be really happy are those who have learned and found how to serve. That is the mission. That's why ECHO works. ECHO is not an unselfish enterprise. It produces joy, joy for the person who does it, joy for the person who supports it, because it changes the world for the better. And that's why I want you to all join this movement. And thank you again for this opportunity to speak to you.
All right, thank you, Dr. Aurora, for traveling from Albuquerque to be here today. My name is Ben Chaddock. I am a second-year medical student here at the OSU Center for Health Sciences. And I am also a big overachiever, and I felt like medical school was not keeping me quite busy enough. I also took on the role of being the SGA, or Student Government Association president. And so on behalf of the entire student body, I would like to extend a huge thank you to everyone here for providing us with the most valuable gift we've ever received, a world-class education. Every student trained in this building is the future of medicine in Oklahoma. And thanks to your generosity, we now have a facility that will elevate that future to something we've never seen before. And it will truly redefine medical education. Having had the opportunity to tinker with the technology that is available throughout this building, I can wholeheartedly say that it is absolutely amazing. Whether it's the simulation center on the first floor or the many interactive learning spaces throughout the building, it is clear that every effort has been made to provide an ideal learning environment for any type of learning style. Additionally, we now have gathering spaces and a beautiful 4th floor terrace where you can go to work on projects, socialize, and discover this so-called outdoors and sunshine that we hear so much about while studying. These new spaces, as Dr. Shrum stated, are invaluable to improving our overall well-being as students and thus amplify our retention of the information presented by our prestigious faculty. It will vastly improve the future of medicine in Oklahoma. We are grateful beyond words to have this innovative learning environment that enables us to reach our full potential. With this gratitude in mind, I'm honored to invite onto the stage, or up to stand up, the Regents, along with President Hargis, Dr. Shrum, Dr. Aurora, Dr. Pettit, Mr. Murphy, Mr. Bartel, and our other donors to help us cut the ceremonial orange ribbon for our beautiful and very orange building.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Thank you to everyone for joining us for this day. And again, thank you for your donations to extend the future of medicine in Oklahoma. We invite you to a reception on the 4th floor of the Tandy Medical Academic Building. While making your way to the reception, please feel free to explore the building. We have faculty, staff, and students stationed in various areas to answer any questions that you may have. And additionally, if any alumni would stick around for a photo op, please stick around. But other than that, have a wonderful day.